So what is the reason for this hypothyroidism, especially Hashimoto's hypothyroidism? First one is increased age. With the increasing age, the risk for hypothyroid increases, and also if you are a woman or being female is one of the risk factor for hypothyroid, because out of every 10 people who is affected by Hashimoto's hypothyroid, 7 people are women and only one person is male. And also, and genetically, if your father, mother, or any of your blood relatives have this thyroid problem, you are more prone to get this hypothyroid. And coming to the pathology of Hashimoto's hypothyroid, so you have to know in depth what exactly happening there, so that you can appreciate, you can know whether your treatment is working good, it is not working, or whether you are improving, or you permanently cured by thyroid treatment. So in order to maintain, or in order to understand whether your disease about yourself, you have to know about the thyroid pathology completely. So what happens here is, so normally when bacteria enters into your blood, or some virus enters into your blood, or some pathogens enters into your blood, or some fungus enters into your blood, any foreign body enters into your body, antibodies has to be produced, or your immune system has to fight against the foreign particles. In this particular autoimmune condition, what happens is your immune cells are going and attacking the normal cells of your body. In this case, the thyrocytes, which are present in thyroid gland, in the follicles of thyroid gland, are attacked by this. Antibodies are produced against your cells, that is thyrocytes. And initially there will be inflammation of thyroid gland. So inflammation in the sense, so your thyroid gland is enlarged. There will be transient hyperthyroidism. So as the thyroid glands enlarges in the beginning, so more thyroid hormones are produced. T3 and T4 are transiently increased, but over a period of time, these cells are dead. These cells are going to die, and these cells will be replaced with fibrous tissue, and overall production of T3 and T4 will be decreased permanently. At that time, uh, the patient lands into hypothyroid. That is the pathology of Hashimoto's hypothyroid. Finally, there will be decreased T3 and T4 levels in the circulation. When T3 and T4 levels are decreased in the circulation, what exactly is going to happen in your body? First one is, it is going to decrease the synthesis of the enzymes or proteins. So what are these proteins? So you cannot produce a much hormones, you cannot produce much uh, enzymes. So your structural proteins which are going to be needed for your growth, these are all not produced. And also transport proteins, so the proteins which are used for transporting different material in your body is also decreased. Overall, protein synthesis is decreased in the first stage. Your body needs sufficient amount of glucose for it to function. So in this case, what happens is, glucose is decreased in the circulatory system. Because glucose is not absorbed, there will not be any glycolysis. So the glycogen is not converted into glucose and it is provided. And also there will not be gluconeogenesis. There is no usage of fat, or there is no usage of protein, and these are not converted into glucose, and your body is not given the energy molecules that are required. And coming to the fat metabolism, so fat is not mobilized. So both cholesterol and triglycerides are increased in your blood. This may lead to heart attacks. There will be deposition of fat, there will be deposition of triglycerides in subcutaneous tissue just below the skin, and also visceral fat. Visceral fat means the fat which is in your belly is going to be increased because of hypothyroid. Coming to musculoskeletal system, your muscles become weak, the muscles become thin, because there is no proper synthesis of proteins that are needed for musculoskeletal system. Coming to gastrointestinal system, so the peristalsis movements are weak. The gastrointestinal system is not able to absorb required nutrients, maybe proteins, maybe minerals, maybe vitamins, carbohydrate, anything you say, anything, they are not going to be absorbed into the body. Coming to body weight, the body weight enormously increases, because uh, the storage of fat, the storage of carbohydrate, the storage of proteins is going to be increased in the body, and there is no clearance of waste material that is produced in the body. Because of these reasons, your body weight is going to be increased, and also due to decreased BMR, what happens is your body is not able to use all these materials and they accumulate in the body. Coming to the circulation, so the circulation is hypodynamic. In case of hypothyroid, your heart rate decreases, the number of beats per minute decreases, your cardiac output decreases, there is no force in the contraction of your heart, systolic blood pressure decreases due to low cardiac output, diastolic pressure remains the same. So overall, your heart is not able to pump the blood that is required to your organs, and it is not able to clear the waste materials that is accumulated in your body. There is no supply of oxygen. And coming to the respiration, your respiratory volumes come down. There is no deep respiration. The respiration is only shallow. You are not able to provide required oxygen for the tissues. You are not able to clear the accumulated carbon dioxide in the tissues. Respiratory rate decreases. The depth of respiration also decreases in case of hypothyroid. Coming to female reproductive system, there is disruption of hypothalamo pituitary ovarian axis. Your hormones go out of place. There will be lot of dysfunction regarding to your sexual activity. In the same way, in males, hypothalamo pituitary gonadal axis is disrupted. Because of that, there will be lot of issues with male reproductive system as well.